Good afternoon, everyone. My name is Niamh Walsh. I am a PhD researcher with Ulster University, and I'm also a registered nurse in intellectual disability, and I work as a CNM2 within residential care within Donegal Intellectual Disability Services. And I'm delighted to be able to address you here today. Today's talk is about the HSE Health Passport for people with intellectual disability specifically, but I will elaborate on how that has transcended more than disability as I go through the presentation. So it's about delivering safe, effective care within the healthcare setting and within and across the communications that we have as healthcare professionals and healthcare staff with people with intellectual disabilities on their journey through all services. So just to give you an idea around the mental and physical health of people with intellectual disability, and I know I may be speaking to the converted here, and many of you would have worked with people who have a comorbid condition of mental health illness alongside their diagnosed intellectual disability. So many of you will already have worked along with people who sit within that category. So there's a huge change in pattern of illness and death within the population, and there's a major increase in life expectancy. But however, our population of people with intellectual disability globally are dying much, much younger than their general population counterparts. Many conditions do arise that are amenable to adaptations in daily care. Sometimes these things are not happening and can result in the untimely death of a person with an intellectual disability. Many reasons for this, many challenges ahead of us to address these amenable issues, but the passport is one way in which we can achieve that. People, again, as I've mentioned already, have great complexity, not always, but a lot of the time, and a lot of comorbidities alongside their lifelong intellectual disability. No assumption should be made when treating someone with an intellectual disability regarding their physical or mental abilities. And in particular, no assumption should be made that that condition that they present with is associated with their diagnosed intellectual disability, which oftentimes occurs. Many of you may have seen this. This is classified as diagnostic overshadowing, where we identify the person's presenting behavior as an associated element of the condition that they are diagnosed with. And oftentimes it's more a representation of an expression of pain or discomfort or a need to communicate with us to tell us what's wrong with them, and not, in fact, associated with their diagnosed intellectual disability. So some of the key challenges that people with intellectual disability face: respiratory disorders are higher. They are the leading cause of death in people with intellectual disabilities. Cardiovascular disorders, neurological disorders, endocrine, gastro, cancer, reduced bone density, and mental ill health. They're not in order. Respiratory is, because it's the leading cause of death, but many people with intellectual disability will have the complexity of these comorbid conditions. There have been historical reports of patient safety concerns in relation to people with intellectual disability, highlighting really, desperate treatment, I suppose, and maybe unexplained deaths, etc., of people with intellectual disability. And there are, the Learning Disability Mortality Review in the UK, which was published in 2017, 2019, they look at the, they don't look at the causes of these deaths, but what they do look at is what were the chain of events that occurred that led to that person's death. It's not a process that we have here in the Republic of Ireland, but it is something that we potentially should look at. But to say that there are many reports around patient safety concerns of people with disability, intellectual disability in our care. One of the, in Northern Ireland, the Regulation and Quality Improvement Authority, which they're RQIA, and they are our equivalent here in the Republic of Ireland. And they looked at the guidelines of caring for people with an intellectual disability in general hospital settings. And what they identified was the need for a passport. And they actually wrote it into their guidelines as well, that people with intellectual disability, number one, should be offered a passport, and if they don't have one, that the hospital settings should supply So it's not that it's mandated in Northern Ireland, but it is definitely part of their HICWA equivalent guideline for care of people with intellectual disability in a general hospital setting. So the rationale for this regional passport, if you like, is that it was about promoting access to people with intellectual disability within the healthcare setting, in particular the hospital settings in Northern Ireland. We know that passports are not new. They have existed for a very long time, but they are sporadic and the use that's made of them is really scant. And it depends really on the awareness of the staff that are receiving them and whether they know what they're looking at, really. There's considerable variation amongst passports that are used. I know I've certainly worked in locations that have one type of passport. I've worked in a location that has another type of passport. So while they're not new within intellectual disability services or learning disability services in Northern Ireland and the UK, they're relatively new to the people who are in receipt of them, whether that's the acute hospital setting, primary care settings, mental health settings. So the work was taken forward for a regional passport in Northern Ireland by Professor Owen Barr to develop a passport for across the region of Northern Ireland. So this happened, it occurred around back 2017, and alongside that, Professor Owen Barr and HSE colleagues, Dr. Anne Gallen and Dr. Randall Parler, had a conversation around how they could pilot the very same passport in the Republic of Ireland and test it to see its viability and its use for people with intellectual disability, which started in the Northwest. So they received permission from the Public Health Agency in Northern Ireland for the passport there and the guidance notes document to be tested and piloted in the Republic of Ireland. The focus was on adults. We just excluded children at the time, and that was only as a test pilot run. Again, minor changes were made. It was not a hospital passport. It was identified as a health passport. That meant it was more transferable across all healthcare settings and not just the hospital setting. From that, a successful proposal for a Vice-Chancellor's scholarship was awarded for a PhD to run alongside the dissemination, upscale and post-piloting of the passport in the Northwest in the Republic of Ireland. And I am that candidate, I suppose, on the end of my journey now, thank God. So the area of research that I was engaged in while leading on the passport nationally was the impact of the passport in achieving reasonable adjustments for people with intellectual disability when in the hospital setting. The evaluations of the passports from both pilots within Northern Ireland and the Republic of Ireland, they really said the same thing. People were saying the same thing. The staff were saying the same thing. The people that use it were saying the same thing. And so it was really positive that a more in-depth exploration of the passport and the use of the passport had commenced. As you can see, the Northern Ireland passport, there are very little variations between them. They're practically identical. Really, the health passport being the major change, just the colour, the HSE, Department of Health and Social Care. So we really adopted the like for like, with the potential that this possibly could be the first of its kind, an all Ireland island passport, if you will, which is phenomenal, really. I mean, we know we're very much on the way to achieving that. Just to give you some information about it, so there's 5 sections in it, all about me. There's a rationale behind the pictures. There's a rationale behind the size of the box and the text that you can put in there. This needs to be something that's accessible to the healthcare professional, but it needs to be something that's determined by the person themselves and easy for them to fill in with support or without support. This also has areas of communication need, medical history, looking after me, how to keep me safe and healthy and happy when I'm in your care. There's a completed by, a relationship to the owner if somebody was supported with completing it, and a date for review as well. So it's a live document. This is not something that stays static. I mean, someone could get a newly acquired dysphagia, for example, and require amendments made to the passport. So supply is really important, and that the person knows to update it as well. This comes also with a guidance document as well. And so while we chat away about the passport, the health needs of people with intellectual disability, the dearth of research that's available on the impact and their needs, yet the many reports that highlight the inequalities, maybe deaths that potentially could have been avoided. The term avoidable death is often used. I wanted to talk and showcase to you some of the people that are behind why it is that the passport is a really important document. So I'm not sure, do many of you know who this young man is, but this is Conor Sparrowhawk. And Conor died in a mental health facility in the UK. He was 18 years of age. He had a seizure in a bath. He wasn't in the care of that facility for very long, and the staff were present, albeit outside the door, but they were present. Very sad circumstances, and maybe, you know, awareness. Again, Conor's death was identified by Leader as an avoidable death. This young man, this is Richard Hadley, and Richard died as a result of constipation. And there are very few people in the Western world that are dying from constipation. However, people with intellectual disability have, and continue to die from an amenable, treatable condition like constipation. Richard had a 12-pound fecal impactation removed, and he died post-op. So again, Richard's untimely death was identified by Leader as an avoidable death. And many of you may know this man. You'll certainly know who his mother is. This is Oliver McGowan. Oliver was a young 18-year-old man with autism. Oliver also had meningitis as a child twice on 2 occasions, and he came through an awful lot. But Oliver died as a result of being prescribed medications that were identified as being, you know, adverse to him. And he'd had adverse reactions, and his parents told the doctors that he couldn't have this medication. Oliver himself told the doctors that he could not have this medication and not to give him this medication, and the doctor overruled the parents and Oliver's wishes not to be administered this medication, and Oliver died as a result of the adverse direction directly related to the administration of the medication that he received. Paula, who's Oliver's mother, has gone on to successfully mandate training for all healthcare professionals within the NHS on intellectual disability and autism, and she's done that in Oliver's name, and it's called the Oliver McGowan Mandatory Training. So you may or may not have heard of that. And I'm going to show you a final picture as well, and many of you may know this home, and this is the Lees Cross Nursing Home. It was the scandal that originally set up, or at least got the ball rolling, to what we now know as our regulator. And I know it's different for mental health, you have the Mental Health Commission, but our regulator of HICWA. And HICWA was established after this primetime scandal, and while there was regulation in place, we certainly didn't have the type of regulation that we have now. And it was the Lees Cross Nursing Home scandal and the deaths of people within Lees Cross Nursing Home, and the very poor care that was provided. But what many people don't know is this young man here, and this is Peter McKenna, and the Lees Cross Nursing Home scandal and the primetime investigation. Peter McKenna was a man in his 50s with Down syndrome who died in Lees Cross Nursing Home, and many people do not know that it's the death of Peter McKenna that brought about this scandal and the family going to prime time, and the investigation that ensued that led to what we now know as our regulator, the Health Information and Quality Authority. And I always like to just remind people that it was a man with Down syndrome who died in that nursing home as a result of poor care that established, or at least led to the establishment of what we now know as HICWA. I think that's a very important point, because many times we do within intellectual disability, and I'm sure mental health, when you're advocating for your services and the people you represent and the people you care for, provide care to, we do have to put our head above the pulpit a lot of the time, way higher than any other sector of the health service. So it is about making the points and really standing and representing who we care for and provide care to in the most appropriate way. And I just think, if anything, I'd really like you to remember the name Peter McKenna. I think as well that if we look at regulation, you know, the last services to be regulated as a result of this scandal were intellectual disability services. So there was the rush was on for the older persons, whatever, all very worthy, of course, as well, of regulation. So the recommendations that came from the two panels as well were in relation to the research, and that's the research journey that I've embarked on and is almost at completion. And that was that a well-designed, well-conducted research study would examine the impact of the health passport across hospital settings. Also an awareness campaign, and what we realized was that we couldn't examine the impact of a passport. People really didn't know about it, you know. So we needed to get the passport used, utilized, running up in the system. Even though a pilot had taken place, we couldn't examine it really if it wasn't being used or people hadn't seen it. So there was a focus put on awareness within the Republic of Ireland. And this is Mr. Paul Gallen, and he is an actor, a young man with Down syndrome. And he was our lead and became a very staunch advocate for the passport, following his role in a short movie. And I'm just going to play that for you now, because it's a real treat and it really gives you insight into what it is the passport is about. So it was about ensuring that the structures were in place to support an innovative and transformative approach to the implementation. And again, this came about as a result, because, you know, you knock on the door, you know, and you talk about disability, it's sort of like, you know, there's, in my experience, there's a half-hearted approach to it, you know, and not everybody is like that. But when you knock on the door, you have to keep knocking. So we always had to be very creative in the way that we approached how we were going to get people to see us. And I think we've achieved that through this short film. So I'm going to actually just play that for you now.
Health passports are being brought into Ireland. They are full of information.
Lad, it's the middle of the night. You're indoors. Take those sunglasses off.
What?
I'm keeping these.
Hey, you! Where'd he go? Went this way!
Health passports help let staff know all about our abilities and needs.
Lost him! I can't see anything in these sunglasses! There he is!
We want to see health passports used all over Ireland. Like they are in other countries.
Okay, Paul, why is this health passport so important to you?
This could be a matter of life and death.
What do you mean, Paul?
It means involving us communication, consent. Let us make decisions. This is about our human rights.
And you think this is the answer?
I don't think it's the answer, because I know it's the answer.
It's okay, guys. Everything he says checks out.
I told you so.
Excellent work, Agent. Here's a word from the Chief.
Well done, Paul. The launch of the Health Passport is going to help staff make reasonable adjustments to ensure people get the care they need.
Here's your own passport, agent. I think you're going to need it, because here's your next mission. Remember, it's top secret.
Everyone down.
This message will self-destruct in 5 seconds. 4, 3, 2, 1.
I find the face. Okay, 84, where's wire?
The red wire, agent. Cut the red wire.
Some people that have passports will struggle to communicate with staff. Where's wire, agent?
The red wire, Paul.
Do we know anything about this young man? Is he on any medication?
It's all here. His name is Paul. He has no medication and he has no allergies.
Have passports, offer everything. From medication, taken, the allergies you may have.
Okay, what happened to this guy?
He was in an explosion, Doctor.
An explosion? We don't see that every day. Do we know anything about him?
Everything you need to know is in here.
Let's make sure whoever is working with Paul reads this passport so they can make the necessary adjustments to get you the best possible care. We're going to need to do a carbon monoxide test, and then we're going to get in touch with your carer. Somebody called M?
Always have to play the hero, don't you, Paul?
Congratulations, Paul. You've successfully completed your mission. Hold on to your passport now, agent, because I think you're going to need it again.
Speaking of which, here's your next mission. Everybody out.
This message will self-destruct in 5 seconds. 4, 3, 2, 1.
Further recommendations that came from the pilots from Northern Ireland and the Republic of Ireland was the potential to explore the transferability of the health passport across the wider general healthcare system and potentially other vulnerable groups. And actually throughout the process over the last, since 2018, we have had numerous contact from mental health services in the West. We've had contact from cancer care services, respiratory outreach services. We've also had contact from voluntary sectors, acquired brain injury, children with complex needs. Even though the passport is suitable for children as well, they want to be able to utilize this passport in the format that it is for those other groups, because this passport is about the needs, the uniquenesses, and the unique identity of the person with an intellectual disability or the person using it, to be able to say, this is what I need you to know about me, and this is how you can support me within this interaction and beyond that on my journey through the healthcare setting. And that's really critical to improved health outcomes. When we get the communication right, when we understand people's needs, we inevitably get it right for their journey, and that is going to improve their outcome. Again, a further recommendation was that there would be co-production, and co-production is huge, of course, in mental health services. In fact, I think from my own observations, I have seen that co-production is central as well to what you do. So it was about considering the individuals with intellectual disability and their families and how they could meaningfully participate in the research. And I know that myself and the supervisory team that I have within Ulster University, and indeed Dr. Anne Gallen herself, this was central to what it is that we were going to do. There was no point in conducting research without having the people who it affected being central to that research. And so even the methodology and the basis of the research, the foundations, the philosophical, underpinnings of the research are firmly rooted in that collaborative approach. So the aim of the research was to explore the use of the passport for people with disabilities and to what extent reasonable adjustments were made where a person with an intellectual disability and their family or carer were able to provide a passport and how that impacted on the care. The first phase was a quantitative questionnaire that I distributed across 2 general hospital settings, and that was to gain an understanding of how they interpret what a reasonable adjustment is. Indeed, many people are providing reasonable adjustments, but they just don't see it that that's what it is. That might be moving that person from one room to another. It might be giving them the first appointment of the day because they've looked, they know the person, they see that they have an intellectual disability, they might double up an appointment for them. And these were things that people just went out of their way to do, but didn't identify as being a reasonable adjustment. And sometimes where we can identify reasonable adjustments, we can replicate them. And it means that more people benefit as well from the reasonable adjustments. The second and third phases involved one-to-one semi-structured interviews with the hospital staff themselves, with staff who support people with intellectual disabilities, with people with intellectual disabilities themselves and their families and carers. Again, their voice being central to the piece. So really, what can the HSE Health Passport achieve? It can recognise that people with intellectual disabilities, full citizens, we need to be heard and seen on our terms, and we need you to hear what it is that we have to say about us within our healthcare. This is about human rights, and this is not just a nice thing to do. The passport really, supports the person to be met on their own needs and in their own right as an individual, where they can't ordinarily advocate on behalf of themselves or largely would have needed additional supports for that advocating. This passport can some way go towards supporting them in that interaction. It can recognise the patient safety risks, and this is really huge. Again, this is not just a nice thing to do. This is about patient safety. I mean, I've demonstrated, I think, across some of the literature and some of the people that I've highlighted to you about how things can go fatally wrong when we don't know the needs and we don't understand the people who we are treating, assessing, number one, and unable to communicate with and unable to meet their communication needs. So we want to be able to be confident in the reception and the admission of people with intellectual disabilities. We want to be able to assess those abilities and needs in the best way that we can. And the passport can also support the facilitation of the person to maintain as much independence as they can when they are in your healthcare setting or across the interaction of healthcare that you have. It also helps provide them with the specialist help that they may or may not need. And also it means that we can work in a more coordinated way with each other in an interdisciplinary and an inter-service team. It's perhaps the first of its kind to have a national impact. There was a huge piece of research done across by the UK by Dr. Ruth Northway, and Ruth looked at the passports that were in use across hospital settings in the UK. No two passports were the same. There were various length, depth, breadth. Some had 2 pages, some were single pages, some were 15 pages long, and they weren't recognizable. And I suppose really the fact that this is a standardized, not only is it standardized in Northern Ireland, there's only a colour change really in the difference between Northern Ireland and the Republic of Ireland. This passport is something that is now recognizable nationally. And that's really important. It's like if I hand my passport in and I'm in Cork University Hospital, we want to be in the position where people immediately recognize it as a communication tool. This person's identified needs are in this. We need to read this before we do our assessment, if I'm in Galway or wherever. And so this was the strategy, I suppose, is that the interface of the passport is really important, that it becomes a recognizable tool that's used for people with intellectual disability across healthcare. So the upscale and the dissemination. So we had huge commitment within CHO1 from Mr. John Hayes. We launched the passport in the Northwest here. We had support from the communications team for that launch back in 2019, and we actually had it in the cinema here in Letterkenny, and it was hugely successful pre-COVID. And we had support. The general public attended. We had ministers. Finney McGrath and Simon Harris didn't attend, but they were huge supporters. We met with Simon Harris in the Department of Health, again, pre-COVID. And so we do have some plans to continue those conversations now when the dust has settled with the new minister. We were successful, and we were awarded integrated care funding from Sláintecare. And really what we managed to achieve was phenomenal. The Sláintecare funding enabled us to recruit 2 CNM2 liaison nurses and a clerical officer. It also enabled us to develop the passport into an app. This was expedited when COVID hit because it was one of the last pieces of the project that we wanted to achieve towards the end of 2021. But when COVID hit in 2020, we expedited that, and that became one of the first things that we did. Given that respiratory conditions are the leading cause of death for people with intellectual disability, this became a priority. And I think nationally we need to be very proud of ourselves of how we looked after our cohort of people with intellectual disability within residential care. We really delivered on what it is that we were trying to achieve in relation to the deliverables, in relation to the funding that we got. Again, COVID potentially enabled us to do that because there was this national outcry for the passport from people who were extremely worried about this respiratory deadly condition for their loved ones, for them themselves, and the potential that they could end up in a hospital setting far outweighed other areas that they would have been previously concerned with. And so the demand for the passport just went through the roof. And just to give you an example of that is when we disseminated, we laid down our deliverables for Sláintecare, and one of them was the number of families that we would be able to have an impact on. And so for the CHO area, we had anticipated and calculated that we'd be delighted to be able to support 400 people with intellectual disabilities and their families, you know, with a passport, how to use it, etc. We supported over 3,500 people with intellectual disability to use the passport, to provide them with a passport and to use the passport. So it was phenomenally successful, and it far exceeded our own expected outcomes. The passport was developed, and I do have a short clip, and I'll be able to showcase to you how that is used in a hospital setting. Everyone who comes in contact with you when you are in a hospital or healthcare setting should read your health passport.
This is my HSE health passport. It helps you support me when in your care.
The Health Passport gives us valuable information. It's an excellent communication tool that allows us to make reasonable adjustments to ensure our patients receive the best possible care.
The HSE Health Passport tells us important information we need to know about our patients. It helps me provide safe care and support people with intellectual disabilities in a safe way.
To help support me and to give me the right care
in the right place
at the right time.
The HSE Health Passport is in hard copy and also available as an app in the Apple App Store and Google Play Store. Just search HSE Health Passport ID and download for free today. Okay, so the app was launched on International Person with Disabilities Day on the 3rd of December, and Sláinte Care were fully behind us in that, as were the HSE Communications team nationally, and we got lots of coverage and spread across media, from RTE to local radio, national radio. So it was really, and Paul gave his own message, and Sláinte Care published that on their Twitter page. So it was really great to see that. So the spread and scale of the passport was across the country. Like, there is no county in the country that doesn't have somebody who is advocating the passport and rolling it out within each of the regions. And what we did was, nationally, we identified champions, HSE Health Passport champions within each area. And just keep in mind as well that the HSE Health Passport has been adapted in other areas, and like that, as I said to you, in the East Acquired Brain Injury, and that is a voluntary organisation who provide residential care to people with acquired brain injury, have adapted it for their use. St Michael's House have adapted it for their use. In fact, they've got some funding awarded to them just this year, and they're using that funding to upscale and disseminate the passport across their services and the hospital settings within which they access. Cork NMPDUs, Kerry NMPDUs, Mayo, Roscommon, Aris attracted themselves as well, who had their own issues in years gone by in relation to the care of people with intellectual disability, made direct contact with us, and we've supplied them with passports too. So it has gone everywhere, and we're delighted about that. And what it is, it's about, I suppose, really, when we looked at this, this was in the middle of the pandemic, and we couldn't believe the demand. We couldn't hardly keep up. It was shipping passports out across the country. And we looked at, how we were breaking down barriers that we anticipated we would have, that we actually didn't have when the pandemic hit, because it was demand led then. And it was almost like a turning point. All of a sudden, there was a huge awareness around disability and information sharing, accessibility. I mean, it just became a buzzword. I mean, these are things that I'm sure yourselves, when you're beating your head off the wall about these things all of the time, and all of a sudden you're finally heard. And it takes something like a pandemic for that to happen. So this was an opportunity during the pandemic for us, rather than the opposite. It wasn't about the project which we anticipated may be curtailed because of the pandemic. It was the complete opposite. And those barriers where we were all of a sudden able to reduce the barriers, to be able to have a level playing field for everybody, because that's what the passport does. And we were afforded that level playing field because of the demand. And one of the biggest things was, how did we achieve that? And the reason why we achieved it and why we were so successful within this particular project is because we kept people with intellectual disabilities very close to what it is that we do. And everybody that you've seen in the videos, or the videos that you will see, were all volunteers. They all wanted to be a part of the project, and they wanted to advocate for something that would benefit them. The research as well, we have a steering group which was set up to support the research team, and they had a dual role in governance when it came to the Sláinte Care project. And there are family members of people with intellectual disability and people with intellectual disabilities themselves as equal members on that steering group, along with healthcare professionals from across the country. So we always kept people with intellectual disabilities very close to what it is that we did. they had to have a seat at your table and at every table. And then I know that within mental health services, that's very important. So I think we're singing from the same hymn sheet there. Huge opportunity came our way then. We were asked to support the HSE communications team to develop easy read literature. And one of the first documents that we supported them with was the Cocooning document. We went on then to develop their restricted movements documents, their travel documents, and this one in particular, which is the self-isolating document, was for people in protective accommodation services. And this one was developed into 10 languages. So this was an accessible, easy read format that we developed on all of the HSE communications that were delivered to the general population were now being developed for people with a cognitive impairment. But not only did they suit people with a cognitive impairment, they suited people with literacy issues, they suited people with an intellectual disability, they suited people with a language barrier. And sometimes the biggest message that I often like to impart is that when we get it right for people with intellectual disability, we have a very solid foundation that we likely have it right for all populations. And that was hugely important. And we were very honoured to be asked to support this work and to develop these documents. It didn't stop there. We continued. We were asked to support in developing the information leaflet for people to partake in a study which related to COVID. And this was quite an invasive study in that bloods were to be taken, etc. And so we needed to develop an information sheet for potential participants that would be inclusive of all of Ireland's population. And I'm delighted to say that this was a piece of research that fed into the World Health Organization on antibodies. And it was done in conjunction with UCD and HSPC. And 5 participants with an intellectual disability took part in this study as a result of the accessible information that they had access to. Whoops. Don't know what I've done there, Philip. Oh, here we go. We also developed the flu vaccine documents and the new national children's flu vaccine documents as well. There was a huge awareness all of a sudden around accessible materials, and I really do believe that the awareness of the passport as a communication tool led the way in relation to that. You will be familiar with this, or at least many of you will be. We're also asked to do the very sensitive report that was published in December of 2021, and that was the Brandon report in relation to abuse that took place in the Northwest. And that was something, again, that we took on board. We were very cautious and we put all the appropriate measures in place to support our advocates who wanted to be a part of the development of these documents, because there's set criteria in relation to developing easy read materials. You must have people with intellectual disability involved in their development. So those advocates who wished to participate in the development of these particular materials were supported in whatever way they needed to be, and we needed to make sure that they had good psychological safety when we were developing this very sensitive piece. We then, subsequent to this report, we were asked to develop the easy read material for the look back review into child and adult mental health services, which I'm sure you're all very familiar with. And again, another report that I worked actually very closely with Dr. Sean Maskey on from the NHS in London, and he was the main reviewer of that report, and he wrote that report. So it was a wonderful opportunity, and still continues to be the demand for these easy read materials, and the demand for the passport is huge. So what has happened? We've been a hugely successful project. We were so successful that we were awarded continuing funding, and that funding came through the Department of Health, and it is embedded into the National Service Plan. So there's a bit of a stay now at the moment just in relation to where that sits, and it will likely sit in National Disability Services The demand is still high for the passport. The app, I just checked before I recorded this video to see how many downloads that we've had to date. We've over 7,500 downloads of the app across 33 countries, from Melbourne to Perth, North America, South America, Germany, China, all across the Arab Emirates. So the demand is there. I mean, people are looking for this. We really didn't think that we would have that many downloads. So the template is there. It's ready to be adapted for any services that wish to take it on board. But I have to say, it is early days. It's hugely successful, and the passport has a long way to go. And it is a document that will support people with intellectual disability access and services. So thank you very much for your time. And I would love to answer questions, but this is a recording, and I will sign off. Enjoy the rest of your conference.